expose more of the nail, and got to be very careful on corners here with this kind of bit. This will help expose a little bit more of that. What I recommend, instead of doing too much more debriding, is to put urea and then put, and I'm going to do that here later, and soften this again so the next time he's back that we can take care of more of this. You don't want to try to do the whole thing on the first visit, because sometimes the skin is just too frail. So you want to check to see if any of this other is removable. And to quiet down that redness right there, you want to soften this whole nail, because now you're back down to hard nail, and this is the skin. You could injure that very easily. So this is nail that can come out in time. You don't want to try to get all of that out on the first visit. So we're going to change the bit from an aggressive bit to a bit that is just a diamond smoothing bit, so we can smooth this down, get rid of any rough edges, and it's not as likely to cause injury. I don't advise doing too much, other than if you can lift it out with a curette. That's the way to take care of these corners now, until you soften them up with about a week or two worth of urea. Here, there's enough of the pathway where I can slowly get a nipper. I don't suggest that the average individual tries this, but you can slowly peel away that and not injure the skin. But that's about as far as I want to take it with the nipper. I'll get rid of any rough areas with this safety bit. And if you feel any kind of roughness, see how red that is down in there? That's from years of packing that nail, packing up in there. And you just want to make sure you're not into a blood supply. So, that's about as far as we're going to take it today. What we're going to do to antiseptically treat this a couple ways. We're going to take some hypochlorous acid and put directly on that, clean it up. You see it's some redness right in there. It's not frank bleeding. You can see there's no blood there, but it's red from being worked with. That's a point of infection that you have to be careful with. So what we want to do is we clean it off with hypochlorous acid, which is a phenomenal antiseptic. We're going to take some 40%, 42% urea. You can use 20% if you don't have 40. This is going to be put on, and then you're just going to put a Band-Aid on it. And the Band-Aid will hold that medicine close to the nail. It will soften it, so the next time you work on this 2 weeks from now, which is generally the time period that it takes, you just put that on there, keeps it in contact with the nail, and softens it. We clean up the area and we can go on to the next nails now. And so these are not as thick, and they're not going to take as long. Underneath here, it's safe enough for me to put my nipper and trim basically retrograde or backwards. So here is a retrograde cut. I'm coming from behind and going forward, and seeing that peeled off right there. We're going to do it again right there. And we're going to slowly advance into the corner. And now we're going to see if that will just peel away safely. If that doesn't, then you come back to doing what you're doing before and grab it. If that's still not helping, take your curette and see if that'll lift. And if it doesn't lift, we come back and we do this again and again until we find a safe edge. This is laminar. You can see where we made a laminar cut right in here, and we're slowly lifting that back. Slowly lifting it, finding where it's attached, and where can we safely take our nipper for the last couple of cuts here. And that's as much as we're going to probably do once we get this piece off. There it is right there. So we just want to make sure there's no skin attached before we close those nippers. And then we just wiggle it. And the wiggling helps expose the attachment point. Sometimes that gives you a good idea of where to quit. Now, we got rid of it. We're just going to check it. If there's any other pieces here attached, we'll come back over to this side and do the same thing. So we're going to burr down one more time on this side. All right, so we're going to put urea on here, clean it up, and just use it. So there's no rough spot. Here is pretty simple. You just find out where the attachment is, and you just do a safety cut right perpendicular to that point. You're coming up here to the very top layer, getting rid of that. You're putting your finger on it so it doesn't fly across the room, just like it did there. And you want to keep that thumb or finger over the top of it. Take small bites so that you avoid the skin. And we're just taking perpendicular cuts. Sometimes we have to take a larger nipper, grab it from top to bottom, and slowly bring it to this, simply for more mechanical advantage. So what we're doing